you've gathered your team, identified some of the built environment challenges, and mapped out the routes you'd like to explore and assess together, it's time to schedule your walk audit. As you think about scheduling your event, there are a few things you will want to consider to ensure that it's safe, enjoyable, and impactful. While it's impossible to meet everyone's scheduling needs, choose a day and time that will work best for community members and align with your audit's priorities. This might mean digging deeper into the goals you have for your audit. What specific conditions and routes are a priority for you to assess? For example, if you want to assess routes that students take to school, you'll need to schedule the audit for a time when children are most likely going to be going to and from school. If you're interested in access to destinations like health clinics, you'll need to consider the hours that clinics are open for patient care. You will also want to think about scheduling to maximize participation. This is a great time to think about how you can recruit community members of all ages and abilities, as well as experiences, to join you for the walk audit. The most successful walk audits are those that bring together community members with diverse perspectives. As the day and time of your walk audit approaches, one of the most important things you'll need to think about is safety. What will the weather be like? Have you planned ahead for a rainy day? Or if the weather is hot, will you have water bottles on hand? What are the conditions of the walking route or routes? Are there safety tools that you will need, such as reflective vests, to ensure the safety of participants? Safety has become even more important during the COVID-19 pandemic. And there may be precautions you need to consider to ensure that you're complying with local restrictions and keeping your participants safe and comfortable during the walk audit. This may involve masks and social distancing, or in some cases, you may even want to shift to a virtual walk audit to best accommodate your participants. You can find guidance and resources for conducting virtual walk audits in the toolkit. Once you have selected a date and time for your walk audit, you can include these details in the promotional flyer template included in the toolkit and share it widely with others.
The Steps to Health walk audit tool was definitely instrumental in helping us to have a successful event. It gives you step-by-step instructions on how to go through from start to finish. It has great templates and resources that we were able to easily adapt to our community.
The fun really starts when your group is gathered to walk together. Route leaders should remember to review the training and the assigned routes in preparation for the event. With a few simple tips, your event will be an efficient and enjoyable experience for everyone. Be sure you remind participants to wear comfortable shoes and to bring any safety or comfort items they might need, like a water bottle, sunscreen, or bug spray. Be sure that all participants have a route map and any other resources they need to guide the walk audit. In our toolkit, we include a walk audit checklist that can help participants evaluate their experiences and document any questions or concerns they may have while walking along the route. Encourage participants to take pictures during the walk audit. Pictures can be a helpful way to provide documentation of what they noticed, whether positive or negative, and it can be a powerful tool for demonstrating needs to your partners and stakeholders. Remember to encourage participation and open discussion within your group or groups. Everyone will have different opinions, and that is okay. Actually, this is great. You want to be sure as many voices from the community are being heard as possible. This experience can be a great tool for communities to understand each other's needs and to work together for a shared purpose of improving local walkability in their area. In order to promote active transportation and health in your community, equity and accessibility must be addressed. Health equity is when every person has the opportunity to attain their full health potential, and no one is disadvantaged from achieving this potential because of where they come from or who their parents are. Health inequities are reflected in differences in quality of life, rates of disease, disability and death, severity of disease, and access to treatment. And it will be important to consider how people of different ages and abilities access routes to destinations around your community. Are there children participating in your walk audit? Or caregivers with strollers? Are there participants with mobility challenges or people who might get around using a walker or wheelchair? Are there older adults participating in your walk audit? Are there community members present who are most likely to be impacted by the area to be assessed? If so, that is great, but you should ensure you're considering the experiences of all the members of your community. If there aren't children or people who use a wheelchair present, think about having someone bring along a stroller or a wheelchair to push so that you can envision what the experience would be for those community members. The COVID-19 pandemic has increased health disparities that many communities and individuals face. As we begin to think about creating environments that promote health for all, a walk audit can be a great opportunity to assess the accessibility of both locations where people can access healthcare and places where they can participate in safe physical activity. Consider adding a COVID lens to your walk audit. Are there vaccine and/or testing sites and healthcare clinics that community members can access without a car? What about pharmacies or other healthcare supply stores? Are there parks and playgrounds or walking trails that are accessible to community members for safe, outdoor, and socially distanced physical activity? How do older adults access these destinations? What about children and community members with mobility challenges? Even as we move beyond COVID-19, these are important considerations for the long-term health and safety of communities.
Sidewalks are essential for especially disabled. Most important thing is accessibility for everyone, and sidewalks provide that. It's amazing how much you find when you do take a walk of things you see, and just to see their participation and some of the things they identified that we walk past every day and never take notice.
In the beginning, we all understand that we're here for one reason, and it's to bring opportunities to this community that's going to improve the quality of health and hopefully bring down the health disparities in the area. Everybody wants healthy kids. We want nice parks. We want environments where we can breathe clean air. So when you find all the things you have in common, it kind of overshadows those things that you don't, because everybody's focused on the things that we can do.
The seniors and young adults in this community and the children can live a more healthy and productive life by walking. I got to see all the unsafe items on the walking trail. So the audit walk really opened my eyes to a lot about a walking trail and a walk audit.
At the end of your walk audit, make sure you debrief with your team to discuss common themes and prioritize improvements that need to be made. It may be helpful to schedule another meeting with your team to create a walk audit report that describes the map of your routes, highlights walkability scores, explains priority issues, makes recommendations and suggestions for improvements, and summarizes next steps. This report is also useful for communicating your results to other partners and stakeholder groups. We've included tips and resources in the toolkit to make reporting results easier and to identify paths for improving walkability in your community.